Lindsay from MobiCare. So I feel like we really need to talk about the flu. You know, influenza, which seems to be rearing its ugly head all over the country. Flu activity is widespread in most of the United States right now. Here in Michigan, we aren't seeing as much activity as the rest of the country, but we will, I'm sure. It seems like there's always a lot of misinformation and confusion surrounding the flu, so I'm going to try to clear it up for you a little bit. So influenza, what is it? How can we prevent it? How do we know if we have it? What do we do if we get it? Influenza is an infection caused by the influenza virus. That's important for you to know. Remember, antibiotics are not effective against a virus, so no antibiotic will get rid of influenza. There are several different strains of the influenza virus. The most common are influenza A, which is actually responsible for about 89% of cases right now, and influenza B. And those are broken down even further into subtypes. The most common one right now is influenza A H3N2, which is causing the majority of influenza illness. All of the strains of influenza can cause respiratory illness. It's important to know that the influenza virus does not cause stomach illness. Vomiting and diarrhea alone are caused by different viruses, not influenza. Although influenza can cause those symptoms, if you just have those symptoms, it's probably not influenza. I'm not sure how stomach flu got its name, but it's totally not flu, which doesn't make it suck any less, but I want to make sure you know it's not the same thing. Flu season in the US is generally from October to April, but it can start as early as September and last as late as May. It peaks between December and February, which is why we're hearing so much about it right now. Influenza is super contagious. It spreads from person to person, from droplets in the air when an infected person coughs, sneezes, or talks. It can travel up to 6 feet. The real kicker is that people with influenza can spread the virus up to 1 day before they even know they're sick. And they continue to spread it for 5 to 7 days after they get sick. So you can see how it causes so much illness. So how do you know if you have influenza? The most common symptoms of influenza are fever, although not everyone will have a fever, cough, sore throat, runny nose, body aches, headaches, and fatigue. I have had influenza the past 2 years, and both times felt like I got hit by a bus. Influenza comes on suddenly. So 1 minute you feel fine, the next minute, bus. It's different from a cold. Usually with a cold, you can kind of feel yourself getting sick. You feel a little bit yucky, and then it kind of builds on itself until you're really down for the count. Most of us, if we get influenza, will get better in a few days, especially if we've had a flu shot, which we're going to talk about a little bit more later. Although it can last up to 2 weeks. If you didn't get a flu shot. The flu can also cause some serious complications. Some complications from the flu include pneumonia, sinus infections, ear infections, bronchitis. Complications from the flu can happen to anyone, but there are some people that are at high risk for complications. People at high risk for complications are those that are over 65, people who have chronic illnesses like asthma, COPD, heart disease, diabetes, women who are pregnant, and young children, all at risk for complications. So how do we diagnose influenza? Well, if you've got a fever, cough, sore throat, runny nose, body aches, headache, chills, fatigue, you might have the flu. Some people, like I said, might have some vomiting and diarrhea. Some people can be infected with the flu and have those respiratory symptoms without a fever. If you've got any of these things going on, especially during the colder months of the year, when flu activity is higher, it's more likely that you have the flu. However, lots of different viruses can cause these symptoms, not just influenza. So it's impossible to tell for sure, 100% sure, if you have the flu based on symptoms alone. The most common test for influenza is the rapid influenza test. This test can detect influenza antigens in the body. The test usually provides results in 10 to 15 minutes. Keep in mind, though, that these rapid tests aren't 100% accurate. They're also more accurate in children than they are in adults. So you may have a negative test, but still have the flu. Most people with flu symptoms don't need to be tested for it because the test results usually don't change how you're treated. You can be diagnosed with flu just based on your symptoms alone. So how is it treated? Well, there are prescription antiviral medications that can be used to treat influenza. These are different from antibiotics, which fight against bacterial infections. Antiviral medications work best for treatment when they're started within 2 days of getting sick. However, starting them later can still be helpful, especially if the sick person is at high risk of serious flu complications or is really sick. Antiviral medications can lessen symptoms and shorten the time you're sick by 1 or 2 days. It's important to note that they don't cure influenza. They shorten the duration of the illness. They can also prevent serious flu complications like pneumonia. For people at high risk of serious flu complications, treatment with an antiviral drug can mean the difference between having a milder illness or a very serious illness that could result in a hospital stay. Although uncommon, some side effects have been associated with the use of antiviral drugs, and those side effects include nausea, vomiting, dizziness, runny or stuffy nose, cough, diarrhea, headache, and some behavioral side effects. I kind of sound like the guy at the end of the drug commercials. Depending on your prescription coverage, antivirals can also be very expensive. So a complete course of antiviral medication can range in price from $50 to about $100. It's important that antiviral medications are started early for people who have severe flu illness, people who are at high risk of serious flu complications. Most people who are healthy and get the flu, though, do not need to be treated with antiviral medications. Most people who have mild illness really don't even need medical care. In most cases, if you get flu symptoms, you should just stay home and avoid contact with other people. However, if you do develop emergency warning signs of flu sickness, you definitely should go to the emergency room. In children, warning signs would include fast breathing or trouble breathing, bluish skin color, if the child's not drinking enough fluids, or they're not waking up or interacting, or they're really irritable and they don't even want to be held. If they have had flu-like symptoms that have gotten better, but then those symptoms return with a fever and the cough is worse, that can be a sign of pneumonia, so that child should be seen in the ER. Or fever with a rash. In an infant, if the child isn't able to eat, has trouble breathing, no tears when they're crying, or has significantly fewer wet diapers than normal, that may be a sign of emergency as well. In adults, emergency signs include difficulty breathing or shortness of breath, pain or pressure in the chest or abdomen, sudden dizziness, confusion, severe or persistent vomiting, flu-like symptoms, again, that get better and then get worse with a fever and a worse cough. That can be a sign of pneumonia. Like I mentioned, though, most people will not have these emergency signs and should really just stay home. It's recommended that you stay home for at least 24 hours after your fever is gone without the use of a fever-reducing medication. You should also wear a mask if you must go out or have to be around other people or take care of your kids. We all know moms and dads don't get sick days. It's also super important to cover your coughs and sneezes and wash your hands regularly to prevent spreading the flu. Speaking of prevention, and I know I'm about to hit a hot button topic here, you should also get a flu vaccine. It's recommended that everyone over the age of 6 months get an annual flu vaccine. It's especially important for those with high risk of complications from the flu. While it's recommended to get the vaccine in the fall, you can definitely still get it now. It takes about 2 weeks for the vaccine to be effective, and flu season is here until April, so plenty of time. And I know what you're going to say. I've definitely heard it all before. The flu vaccine isn't effective this year. So really, it is effective against one of the common strains of influenza, the H1N1 strain. It seems to be about 50% effective for that one. For H3N2, you're right, it isn't quite as effective. It's only about 10% effective, but it is still believed that it lessens the symptoms if you do get the virus. And some of you are also going to tell me that you get sick every time you get a flu vaccine. And I'm sure you know that I'm going to tell you that the flu vaccine doesn't make you sick. So generally, here's what happens. The flu vaccine is given in the fall or the early winter when tons of respiratory viruses are floating around. What happens sometimes is that someone has already been infected with one of those other respiratory viruses. Then they get the flu vaccine, coincidentally. And then the symptoms of that virus kick in, the one that they were infected with before they got the flu vaccine. So essentially, they would have gotten sick regardless whether they got the vaccine or not. It's just coincidental that they happened to get the vaccine before the symptoms of the other virus started. And I know some of you aren't going to believe me, and that's okay. But I wouldn't be doing my job if I didn't provide you with all of the info and with my recommendation that you get the vaccine. But it's ultimately your decision. So let's recap. 1, get a flu vaccine. 2, if you have symptoms of the flu, fever, body aches, cough, sore throat, you don't necessarily need to be tested or treated unless you're at higher risk for complications from the flu. For most of us, though, the best thing we can do is stay home, get lots of rest, drink lots of fluids, take Tylenol for those body aches and fever, and really just wait it out. If you have questions about influenza or you think you might have the flu and aren't sure what to do, we can always do a telehealth visit or a house call. MobiCare members, you can call anytime. I hope you enjoyed this video. If so, please don't forget to like and share it, and I'll see you next time.